Well, it is WesTex Wednesday, and that means that Dr. Beck is joining us now live in our studio to help us stay healthy out there. Thank you so much for being here.
Good morning. Thank you for having me.
So today we're talking about the lungs because we're going to address vaping and smoking next week, but we really want to talk about some issues that can occur to the lungs that don't have to do with that, like lung cancer, lung disease, those things like that. What are some common things you see?
Well, probably the most common lung problems that we see in medicine and emergency medicine are COPD or emphysema, chronic obstructive pulmonary disease, and asthma. Of course, asthma is something that if someone has asthma, they've usually had it since childhood. COPD is a condition that develops usually after years of exposure either to chemicals or smoke, and they can behave and are treated somewhat similarly, but there are differences, of course, too. Asthma, again, there's a lot of times a family history of asthma. In other words, mom or dad may have asthma, and it can be really scary, especially when your little one can't breathe. I mean, and when you can't breathe either, but if we're talking about, say, children and with asthma.
Because they're not sure what's going on.
Right, yeah. And if you've ever had something where you can't breathe, it's just very scary.
Absolutely.
Very scary.
And what do doctors look for when examining someone's lungs?
Well, when we're listening to the lungs, we're listening for several things. We're listening for air movement. In other words, is that person breathing adequately where we can hear air movement? And there's things to listen for too. Wheezing, for instance, with asthma or COPD, when they're having a flare-up of their asthma or COPD, we typically will hear wheezing. The other thing is if we don't hear air sounds or breath sounds in a certain part of the lung, that could be indicative of pneumonia or fluid in the lung or something like that. And there's other sounds that we listen for, crackles and rails, that could be a sign of things like congestive heart failure or pneumonia.
And so, especially with some of this dry season coming with the cold air, we have humidifiers and dehumidifiers. Can you break those down for us, and are they really healthy for the lungs?
Well, the interesting thing about humidifiers and dehumidifiers, every lung condition in every person may have a different thing that sets off their breathing problems, whether it's asthma or COPD. Some people do better with different lung conditions where the air is more humid, like near the coast, or areas where there's higher humidity, and other people will do better where there's arid conditions like the desert southwest where we are. So it just varies. I can't say that one person or all people are going to do better with either higher or lower humidity. It can just vary. For instance, in the summertime, we know that that can set off COPD with the heat and the humidity, but the dry, cool air in the wintertime, like we're experiencing now, or starting to experience, can also set off asthma or COPD. So it could just vary. It's like if we could have one temperature all the time and not vary the humidity significantly, then that would be best. But obviously, that's not realistic, and that's not how our environment is.
And okay, that's so interesting because usually when it comes to humidity, you think skin, as far as dryness and
definitely
how you
helps.
take care of yourself. But very interesting to see what happens inside your body when the conditions are humid or dry as well. How can people take better care of their lungs and their health?
Well, obviously things like not smoking, avoiding chemical exposure. There are certain towns and areas where there's a lot of pollution. And if you have underlying lung conditions, it's best if you live in areas where there's not a lot of pollution. I think in the United States we've done a good job of trying to clean up our air and our environment as far as pollution, but there are areas that are better than others. And now in some foreign countries, it's a different story. We don't have any control over that. With the Environmental Protection Agency and other agencies out there that really look at air quality, the United States has done a pretty good job at trying to get rid of or lower levels of pollution. So avoiding things that tend to irritate it. Again, we haven't really talked about cancer yet, but of course cigarette smoking is a big risk factor for lung cancer.
Absolutely.
And COPD. So those are the main things. Staying in good shape physically, staying active, and some type of physical activity will also keep your lungs in better shape.
Well, thank you so much for being in our studio this morning, Dr. Beck. But we will have more news for you after a quick commercial break and a final look at your 7-day forecast.